Hi, I'm Rob Followell with the Leadership Coach Group. Did you know that recent studies have shown that 70% of American workers are not engaged, and that 52% of workers are not committed to or involved in their work, and 18% are actively disengaged? This cost of lack of engagement is estimated at over $550 billion each year in lost productivity. It often leads to turnover as well. And as you know, the true cost of turnover is absolutely staggering. The National Healthcare Retention and RN Staffing Report indicated the average cost of turnover for a nurse ranges from just under $40,000 to almost $60,000 for one nurse. Now that's a lot of money, and that comes right off the bottom line. It's money that could be used to spend on improving the healthcare of your community. Listen, I want to give you 6 tips to increase engagement and reduce employee turnover. All right, here are 6 tips for increasing employee engagement and reducing turnover. Number 1, know your team as individuals. People need to know that they are more than human capital, more than human resources. They need to know that you care about them as individuals. They need to know, you need to know about them, what's impacting their life, good or bad. Life celebrations, maybe one of their children's getting married. Maybe they've got an aging parent who's ill. Maybe they're having marital issues or financial woes. Maybe they're dealing with the sickness of a child or a struggling child. I remember as a hospital CEO, I had an employee one time who was dealing with the drug addiction with their child. She was concerned about the welfare of her beautiful little granddaughter. She had been taking care of her granddaughter, and oftentimes it was without any notice at all. Out of love and concern for this child, she would do and did whatever needed to be done. She was ashamed, and frankly, she was embarrassed to let very many people know what was going on with her daughter. Those who did know tried to cover for her. She often missed meetings or was late to meetings. Her performance at work really suffered. And without understanding what was impacting her life, I was ready to terminate her. But once I understood the circumstances, I was able to empathize. The rest of the team, we picked up the slack for. Listen, we all have struggles in life. The beautiful part of being a part of a team is that we can be there for each other. We can protect and surround each other because we're all going to be there. But to do that, you have to know your people. You have to know their strengths. You have to know their weaknesses, their fears, their dreams and aspirations. And you need to know what their capacity is, what their capabilities are, what their limitations are, any training needs that they may have. You have to know your people. Secondly, communicate often. You can't possibly know your team if you're not communicating with them. Your team needs to hear from you. They need to hear a consistent message, and that means that you need to communicate often. Communication, oftentimes until you're absolutely sick of hearing yourself. Remember that when you are communicating, it is your responsibility to assure that the other party hears the message the way that you intended for them to hear. I remember recruiting a new physician one time to a dysfunctional medical staff, and each month I communicated verbally to every medical meeting that we had. And then I updated through that what the recruitment status was. I talked about why we were recruiting and what we were recruiting. It was just an update. I published a monthly newsletter, which I posted personally in the physician's lounge, at dictation stations, at the nurse's station. I thought I was doing everything that I possibly could. And yet when that physician started, some of the physicians, it may have been selective hearing, said, I didn't know anything about this. You have to over communicate. When you're sick of it, communicate even further. Tip number 3, connect the individual's role with the overall mission, with the purpose of the hospital. People need to know that what they do matters. They need to know how it impacts other people, whether it's patients, family members, employees, community members. When you do this, it also helps increase the appreciation that teammates have for the strengths of the other team members. I always shared with my housekeepers when I was talking to them how what they did really mattered. I would share that as a housekeeper, the patient in the ER bay doesn't know necessarily or can't judge the clinical care that they may be receiving from their nurse or from their physician, but they are in a very unique position to judge the cleanliness of that ER room. Lying there on the stretcher, they can see dust bunnies that may have collected under equipment or up in the air vents. And those red spots, maybe from too aggressively clearing a syringe and hitting the ceiling tile, or maybe it was the use of betadine and on the floor. Any red spot from a patient is seen as a blood spot. Each housekeeper plays a significant role in patient and family satisfaction, not to mention mitigating hospital-acquired infections. Tip number 4, delegate effectively. When you delegate effectively, you not only reallocate time towards things that add greater value for you and for the organization, you now help your team to grow further. You demonstrate that you trust them. And as we know, trust is the foundation for all relationships. You really tap into their superpowers. When you delegate effectively, your team will surprise you with what they can accomplish. And over time, they can do it likely better than you could have done it. I once had a materials manager who I continued to groom, and I continued to give him more and more responsibility, more departments. In fact, I took him to another town with me as I changed jobs. His attention to detail was absolutely incredible. His creation and use of scoreboards was absolutely second to none. He exceeded my expectations, and he managed those departments far better than I could have. He is now an outstanding hospital CEO. Tip number 5, provide opportunities for autonomy. Management yields compliance, but it's self-direction that yields engagement. Wherever possible, give your team input and autonomy over 4 things: time, task, technique, and team. Tip number 6, provide feedback through a compelling visual scoreboard. Regular, meaningful feedback is truly the secret sauce for engagement and self-improvement. Providing a regular cadence of accountability and feedback using a visual scoreboard where your team can see at a moment's notice if they're moving the needle towards those established goals and the mission is so powerful. The members of your team need to know if they're winning or losing at all times. As individuals, we all have a strong desire for belonging, and your individual purpose must be in line with that of the organization. You need to know your team. You have to coach them and mentor them to be all that they can be. As Maslow says, one must be all that one can be. Anything less than that is just missing the mark. Your team members will not grow to their fullest, which means your hospital won't either. It'll cost you in turnover. Listen, if you follow these 6 tips, I guarantee that you will see an increase in employee engagement. Listen, there's nothing here that you haven't heard before. The key is, are you doing them? Reducing employee turnover offers a measurable return on investment. Maybe you need somebody to walk this journey with you, someone who's been in your shoes. Well, I've been there, and I'm here to help you reduce employee turnover and to help you develop your leaders. The Leadership Coach Group offers executive coaching, team coaching, leadership training, 360-degree leadership assessments, personality assessments, and much more. As John Maxwell says, if you want to grow an organization, grow its leaders.